Sacroiliac joint is a joint that's on the side of the lower back area on each side. This is also called the hip area by patients, usually referring it to as the hip. So there's two sacroiliac joints, one on the right side, one on the left side in the lower back. Now, when women are coming near having childbirth and pregnancy, the ligaments loosen up in the spine and they can develop sacroiliac pain. Sometimes the joint gets injured and you can get chronic sacroiliac pain in these women. Otherwise, in a car accident especially, we can have isolated sacroiliac injury and that can cause pain on one side and maybe the other one also, but usually one is worse than the other. Classically, the L5 disc, which is the lowest disc out there, if that disc is leaky and bulging out, it may cause sacroiliac pain very commonly, and it may be bulging to one side or the other. Now, literature has different numbers, but commonly speaking, we see that around 80% plus minus some percentage, the sacroiliac pain is from a leaky disc, and about 10 to 20% cases, it may be from a car accident or some other kind of injury. So, and you know, sometimes people have both a disc that's bad and sacroiliac pain from an injury, so it's a dual pathology. The key is to look at the films, isolate, identify what is the likely culprit of the pain, and then we try to help heal the issue. If it is an isolated sacroiliac joint issue, in that case you can try to help it by regenerative medicine techniques. There are options of PRP, growth factors, stem cells, and these options we can use. A classic sacroiliac patient does not put weight on one hip, the one that is injured more, so you'll see them sitting off the hip commonly. They'll have a lot of trouble turning in bed at night, and it is not absolute, but you know, pain usually goes down the back of the thigh. If it does, the back of the calf, it may go to the heel or the outside of the toes. Now, S1 nerve root commonly also presents exactly the same way. So the key is look at the films, MRI, make sure that the L5 disc is normal or not, and it is not pinching the S1 nerve root particularly on that side. If the MRI shows that there is no pinching of the S1 nerve root on that side or L5-S1 segment on that side, and then you have a pure sacroiliac problem, and you can focus on fixing it with regenerative medicine techniques.